So many of us believe that clearing congested pores requires aggressive force, harsh scrubs, painful tools, and squeezing until the skin is red and irritated. But the truth is, deep pores don't need force. They respond to a thoughtful sequence and adequate contact time with the right ingredients. It's about working with your skin, not against it. Today, I'm sharing my Dr. Lee-inspired step-by-step detox protocol. This is a gentle, effective method designed to systematically clear clogs, reduce the appearance of pores, and fortify your skin barrier, preventing future congestion before it even starts. To make this easy to remember, we'll follow the DETOXLE framework. This is our roadmap. First, DETOX stands for degrease, to dissolve surface-level oils and makeup. Enzyme Prime, to gently loosen the top layer of dead skin cells. Targeted acids, to penetrate and dissolve sebum inside the pore. Only Ready Release, for the safe and gentle extraction of surfaced blockages. And X-Out Inflammation, to calm and soothe the skin immediately after. Then, we follow up with LEE, Lock in Moisture, to rehydrate and balance the skin. Everyday SPF, to protect against damage that can worsen pores. And Elevate Weekly, to maintain your results with targeted treatments. Let's begin. Step 1 is to degrease. We start with an oil-based cleanser on completely dry skin. The principle here is, like dissolves like. This golden oil will latch onto the oils in your makeup, your sunscreen, and the hardened sebum in your pores, melting them far more effectively than a water-based cleanser alone. Massage it gently for a full 60 seconds. This contact time is non-negotiable. It's what allows the cleanser to do its work dissolving impurities without any harsh rubbing. Now, add a little lukewarm water to emulsify. You'll see the oil turn into a milky liquid. This is the magic step where the cleanser encapsulates all the dissolved grime, allowing it to be rinsed away cleanly without leaving any greasy residue. Rinse thoroughly. This first step alone is a game changer for preventing the buildup that leads to blackheads. Immediately follow with your second cleanse. Go right in with a water-based gel cleanser for another 60 seconds on damp skin. This removes any remaining water-based impurities. If you have oily or acne-prone skin, a formula with a low concentration of salicylic acid is ideal. For those with sensitive or reactive skin, opt for a gentler cleanser with soothing ingredients like heartleaf, cica, or green tea. After rinsing, your skin should feel clean but still have a smooth glide. It should not feel tight or squeaky. That squeak is a cry for help. It means you've stripped your skin's protective barrier, which can trigger inflammation and a surge in oil production as your skin tries to compensate, leading to even more clogs. Now, pat your skin mostly dry or let it air dry for about 30 seconds. We don't want it bone dry, just no longer dripping. This brief pause helps your skin's pH begin to normalize, creating the perfect canvas for the next step. Step 2. Enzyme Prime. This is a crucial but often skipped step. We're going to use a gentle enzyme cleanser for 45 seconds. You can use a dedicated enzyme wash or mix a bit of enzyme powder. Look for papaya or pineapple extracts into your regular gel cleanser. These enzymes work like tiny Pac-Men, nibbling away only at the very top layer of dead skin cells, the keratin cap that seals oil and debris inside your pores. This thins the plug, making extractions easier and often unnecessary. Rinse gently with lukewarm water and no friction. This is why we skip harsh physical scrubs and spin brushes. They can cause micro tears in the skin, which your body then tries to repair, often creating more plugs and inflammation in the process. Step 3. Targeted acids. With the surface prepped, it's time to go deeper. We'll map press a beta-hydroxy acid, or BHA, onto congestion-prone areas. Use a low concentration, between 0.5 and 1% salicylic acid. Apply it only to the nose, the sides of the nose, and the chin. The key is to press, don't rub. This ensures targeted application without causing irritation elsewhere. If your cheeks are sensitive, swap the BHA for a gentler acid in those areas. LHA, a derivative of salicylic acid, is larger and penetrates more slowly, making it less irritating. PHAs are even larger molecules that work only on the surface, offering gentle exfoliation with added hydrating benefits. Use these acids 1 to 3 times a week at most. Now wait. Let the acid sit for 60 to 90 seconds. This contact time is essential for the acid to penetrate the oil and dissolve the clog from within. Step 4 is Only Ready Release. Before you touch anything, perform a traffic light check. Green light means go. This is a soft-tipped blackhead or a distinct whitehead that is clearly at the surface. Yellow light means caution. This is a closed papule or a clog under the skin with no visible head. Treat it with topicals only, do not press. And red light means stop. This is a deep, painful, inflamed cyst. Never attempt to extract a cyst at home. You will only push the inflammation deeper and risk severe scarring. For a green light blackhead, work on dry, clean skin. Sanitize a round loop tool with 70% isopropyl alcohol. Place the loop slightly past the pore, then gently roll it back along the direction of the pore with low, even pressure. Never press straight down. The goal is to ease the plug out, not force it. For a whitehead, use 2 cotton swabs. Place them on either side of the blemish at a 45-degree angle. Press in and then gently roll upwards to lift the contents out. For both methods, follow the rule of 2s. Give it 2 gentle tries. If the clog doesn't release, it's not ready. Stop immediately. Forcing it will only cause trauma and hyperpigmentation. After any release, immediately sweep the area with a sterile saline solution to clean it, pat dry, and apply a micro dab of salicylic acid directly onto the opening to keep it clear. If there's any fluid or an open spot, apply a hydrocolloid patch. This will absorb drainage, protect the area from bacteria, and create a moist, healing environment. Now for step 5, X out inflammation. For any red spots or areas that feel warm or pink after extractions, use wrapped ice and glide it over the area for 30 to 45 seconds. This constricts blood vessels, reducing redness and swelling instantly. For those red light cysts or yellow light papules, a short contact application of benzoyl peroxide or a sulfur spot treatment can help reduce inflammation without needing to squeeze. Now we move to our LEE Aftercare, starting with lock-in moisture. Your skin is now primed for hydration. First, press in a watery, soothing essence with ingredients like Centella asiatica, mugwort, or beta-glucan to calm the skin. Follow immediately with a lightweight gel or gel cream moisturizer. Look for ceramides to repair your skin barrier and hyaluronic acid to draw in water. Properly hydrated skin is balanced and less likely to produce excess oil to compensate for dryness. Next, everyday SPF. This is non-negotiable. Sun exposure damages collagen, which can slacken pore walls and make them appear larger. It also triggers inflammation. Every single morning, apply a broad-spectrum sunscreen with at least SPF 30. To maintain protection, reapply midday. You can gently blot excess oil with a blotting paper, then use a powder or spray sunscreen for a quick, easy reapplication that won't disturb your makeup. Finally, elevate weekly. To maintain clear pores, incorporate a weekly treatment. A clay or charcoal mask for 10 minutes can help draw out impurities. On nights you don't use acids, consider introducing a gentle, over-the-counter retinoid to accelerate cell turnover and keep pores clear from within. And a note on steaming. Use it with caution before your cleansing steps, for no more than 5 minutes and at a safe distance, to soften plugs. Too much heat can exacerbate inflammation. And always keep your tools sanitized. So there you have it, a complete, systematic approach to deep pore care. Degrease, enzyme prime, targeted acids, only ready release, and X out inflammation. Followed by locking in moisture, everyday SPF, and elevating weekly. Remember, consistency is more important than intensity. This routine is a powerful tool, but if you struggle with persistent, painful acne, it's always best to consult a board-certified dermatologist.